Now time for News Extra, brought to you by Gering Civic Center. And with that, here is Kevin Mooney.
And thank you very much, Dennis. Good morning, everyone. Our guests today are Alicia Fillingham. She is the Emergency Department Clinical Coordinator up at Regional West Medical Center, and Alicia Kunz. She is the Emergency Department Manager. And both these gals are in here to talk about a new stroke telemedicine program up at the hospital. And we'll let Alice speak about it first. This is all about a robot that we're trying to name out front here. I thought Carl was a good name, but anyway. All right, so Alice, tell us about this rather unique thing that you guys are doing, the first hospital in the state to do this, right?
Absolutely. This is a really cool new piece of technology that's able to team up with our emergency department physicians to provide the latest and greatest cutting-edge care for our patients who present with stroke-like symptoms.
Okay, so this robot is in your emergency room. You guys go in and you diagnose a stroke patient, right?
So the first thing we do is we recognize those symptoms of a stroke, those initial symptoms that make us worried that the patient might indeed be having a stroke.
Okay, and then so you look at the patient, do some diagnosis, and then you hook up this robot, and the robot then they can look at the patient over at Swedish Hospital in Denver and give you kind of a second set of eyes, right?
Yeah, so what happens for that patient is we take them immediately to CAT scan, because that's going to be a good picture, a visualization of their brain. And while they're in CAT scan, we're dialing up and connecting with Swedish, so we can actually have a stroke neurologist right there on the screen for the patient to take a peek at them as soon as they get back.
All right, and so the folks over at Swedish Medical then look, and between the two of you, you can kind of diagnose what's going on, right?
Yes. They team up with our emergency department physicians that are excellent at recognizing strokes and diagnosing a stroke, and it's just a great partnership.
All right. And how many times have you used this to this point?
We just implemented it February 9th, and we've used it 6 times already.
Wow, that's fantastic. So 6 times already, and it's worked out well for you.
Yes.
Okay. All right, let's get Alicia on here for a minute. Okay, so tell us what, obviously when somebody feels like they might have stroke symptoms, a lot of times, almost all of us say, well, I don't want to go to the hospital, I must just be feeling bad or whatever. What are the telltale signs of somebody having a stroke, or if you're viewing somebody having a stroke?
Well, we use an acronym called FAST, so F-A-S-T. F is for face, so if you have any facial drooping, that's a sign. A is for arms, so if you can't lift your arms or your arms seem weak, that's another sign. S is for speech, if your speech is slurred or off, or if somebody else tells you that your speech is off, that's another sign. And T is for time, and time is important because every second, 30,000 brain cells die during a stroke. So the faster you can get to the hospital and we can get you treated, the better.
Yeah. And so you need to get up there and have you guys look at you and so forth and know what's going on. And is loss of balance part of that too?
Yes, loss of balance could be one of the signs also.
Okay, I was going to say I think that's one of the signs as well. All right. Okay, we'll take a break and we'll be back with these 2 wonderful women right after this.
Why trust a newbie with your special day? The Gering Civic Center, with 21 years of wedding experience, combined with the Meat Shop's 31 years of cooking experience, have earned your respect, with excellent service and delicious food. With a professional staff to assist in planning your special day, call Western Nebraska's premier multifunction facility at 436-6888, or visit us at GeringCivicCenter.com, or like us on Facebook.
All right, we're back on News Extra, and we're talking to a couple of emergency room employees over at Regional West Medical Center. Very knowledgeable young ladies. Alicia Kunz, who is the emergency department manager, and Alice Fillingham, the emergency department clinical coordinator. Alice has been at the hospital for about 8 years, and Alicia came here from South Dakota. She's been here about 3 years, and we're talking about a new stroke telemedicine program where they have a robot that can actually help diagnose stroke symptoms and exactly what's going on in cooperation with Swedish Swedish hospital over in Denver. So, Alicia, tell us how this works. So the patient, like Alice was saying, maybe goes in for a CAT scan. And while that's happening, you guys kind of hook this robot up. Does it take very long to do that?
No, it's actually a really quick process. We dial in the neurologists at Swedish Hospital. They pop up on the screen for us, and the neurologist is able to zoom in, change views. They can zoom right into your face and see the pupils in your eyes, the freckles on your nose, everything. We also have a stethoscope on this robot, so we can get lung sounds, and that neurologist on the other side can hear what we're hearing right there in the ER room.
Wow, fantastic. And you guys, obviously, since you're the first hospital in the state to do this, you guys got special training to do this?
Yes, we Swedish employees have been out here and done a lot of training with us recently. We've also done many simulations to see how this is going to work. We've worked on protocols and procedures in the back end, and we're going to have a lot of future training from Swedish hospital for our EMS staff and nursing staff and physicians at the hospital.
All right. Real quick here, Alice, you guys have used this 6 times, obviously, already, you said. Since February 9th, and it's worked very well. Did it actually help you diagnose, do exactly what you thought it might?
Absolutely. You know, this is another tool that they team up with our doctors, but it works smoothly, and we were really happy with the process.
All right. What's the name you like for this robot?
I like Carl as
well.
well.
You like Carl as well,
I do.
Huh? Okay,
I do.
You said Tessa and some other ones, but...
Oswald.
But Carl is pretty cool, I think. So maybe we have a name for him. All right, very good. Well, thanks for coming in. This is wonderful stuff that you guys are doing up at the hospital. And good luck with it. It looks like it's going to be great for you guys.
Thanks so much for having us in.
All right, thank you. Alicia Kunz and Alice Fillingham with the emergency room over at Regional West Medical Center this morning.